Hello everyone, this is Dr. Smriti Shrestha. I'm a dermatologist and a hair transplant surgeon. Welcome to my YouTube channel. Today we have a very special guest. He's very popular, very generous and a very kind personality. He's a social media influencer and a full-time content creator. He's very popular among all of us. Welcome to my channel, Mr. Parakram Rana.
Thank you, doctor. How are you?
I'm good. How about you?
I'm good.
It's so good to have you here.
Likewise, as always.
Alright, so how's life?
Life is good. Busy with work here and there, but it's going great. Balancing my difficult life, hectic life with looking good.
Wow.
That's how you are there for me.
Yes, so how do you look good? Let me ask you.
By coming to this clinic? No, but I take care of my skin. That's something I think I've learned from my parents, to take good care of your skin, and that's what I do.
When it comes to skincare for men, I think there's a lot of confusion. Many men do not even do skincare and some of them don't even know about it. So in your opinion, does brand matter? It's a very important question. I think many of the women would like to know the answer more, I think. Does brand matter when it comes to skincare, and does brand matter to Mr. Parakram Rana?
So I think skincare is one place where I'm not too particular about the brand. For me, it's more important that the ingredients are good. You know, like for example, if I'm looking for retinol, I won't be like, this brand will have good retinol. Then it doesn't matter. The product and the quantity of the ingredient needs to be good. And if retinol, the amount of percentage I want is in different brands, I wouldn't mind choosing any. Mainly for me, it's like the ingredients have to be good. Obviously, there will be some brands, co-products, where people recommend use this serum or that. For that, yes, we'll go for it. But otherwise, I think it's more important. The ingredients are more important. Cleaner products, not too harsh, and the ingredients that you want. That's how I see it and select.
Yes, I see that kind of version going around in social media a lot, that even doctors say that the brand doesn't matter. To me, it's a 50-50. For me, it's like, for example, today itself, I had a patient who was using certain retinol from one company, and then she switched to another one, which was cheaper for the budget point of view. But then the second one did not do the job that the first one was doing. So I think you don't have to really follow and pursue international brands, or like you don't have to really hoard brands. But then you do have to keep at the back of your head and try to check whether it's working on your skin or not. I think that's the most important thing. For example, if you take two brands, always do compare how the results it is showing, what results it is showing, and how it's working on your skin or not.
And the reviews are nowadays on YouTube. There's so many reviews. It's better to see all of that, because all these acids I've started using only in the past 1 year. So I think 1 more year if I give it, then I'll know how they've worked on my skin, with a longer term. So I swear by retinol. I think I've switched to retinoid slowly from retinol, and niacinamide. I usually alternate. I do niacinamide one day, then retinol, and then I give a break with only moisturizer, and I follow that. But first, I've bought everything. I have everything, and with time I've realized that basically I just need these two are my main ingredients, and then sometimes as per if your skin needs it, then I use other acids also.
Wow, I'm really happy to hear that, because these are generally neutral products. They're not that acidic. So if somebody is actually wanting to start with acid or start with active ingredient, I think these two are the best ones to start with. So there are others like AHAs, BHAs, which I think everybody cannot tolerate. Some people develop purging, some people develop irritation, some people develop eczema, so being eczema prone, it's very difficult. Yes.
So those kind of things I use once or twice a week, like glycolic acid or AHA, BHAs, or that red peel. What is the peel?
Wow, ordinary.
Oh, wow. Purest solution also has that. So I use those once in a while, but I don't use that often, because I think.
So how do you take care of your skin after you do that red peel? How do you take care? For how long do you take care of your skin?
What do you mean? In what way? Like I usually put it at night.
There's actually a term called skin priming, which many doctors usually do not talk about. And nowadays in India, I think slowly it's becoming a norm. And if you look at European journals, they always emphasize that you need to prime your skin before and after doing any sort of peels. Anything that peels off your skin is going to expose your bare skin. like a baby skin.
Yeah.
So you need to prime before, that is like at least 2 weeks before. You need to wear good sunscreen, you need to wear retinol, either depigmenting creams or something that will keep your melanocytes at bay, right? To control your melanocytes from becoming hyperactive. And afterwards, after you do that red peel, it leaves on a very good looking shiny baby skin, glistening skin, but then at the same time it is always at more prone to physical trauma, sun damage.
So I put lots of sunscreen basically the next day. I make sure. No, I think that's important.
Sunscreen and sun protection.
Yeah, I think the one acid that works for me like magic, but I don't use it often, is glycolic acid. Ordinary has it in 8 or 9%, which is a little harsh. I get purging.
Yes.
I have never gotten purging. My skin is not sensitive, but with that I got purging. So I stopped using that on my face. I use that on my skin for bumps. I use it on my scalp when it's flaky and it goes.
Wow.
The ordinary one. But Purist solution, which I'm using, they have glycolic 6%. That is not as harsh on your face. So I use that once in a while. But I think glycolic acid is one magical acid that really does wonders if you use it smartly.
Yes.
Anywhere in your body, like even from sweating or bumps, or it's quite magical for me.
Very true. Everything that you've said is very true. Glycolic acid is like a master of everything kind of a thing. So if you use like that, it's definitely worth the call, I think. But then you have to be careful as well because it's an acid. So always moisturize afterwards. So coming to all these acids and all, among your own friends, how many of your male friends actually ever talk about or do routine religious skincare?
Very few. I mean, and I'm always the one pointing out and saying, you have such a good face, but what do you like? I'm that kind of friend who will be like, you don't take care of your skin, like you don't put sunscreen, and because you can make out when a person doesn't put sunscreen because you have a little sunspots, and however good your face is, you can see the skin is a little damaged.
Texture.
Yeah, the texture. So all of that, and I psych them up, I scare them. I'm like, you will get wrinkles, your face will like sag by the time you're 30, 35, so do it now. Because I think the two basic things to start with is at least at night moisturize and at day sunscreen. At least start with those two things, and that's a step for a guy. But you'll know also, like, I mean, I don't know how many men come as compared to women for like skincare issues here.
We have to say 20 out of 1 probably.
Yeah.
20 women, then one guy.
Yeah.
But it's getting better. We're happy that it's getting a bit better. That's why for men, whenever they come for skincare, I don't give them too many products. I just give them 3, sunscreen, moisturizer and a face wash. And I tell them, if you are religious and if you are consistent with this, then let's take it a step forward and then take something else.
Because they'll get scared and run away.
Yes, because it's the cost as well. So, the cost comes, and then it comes about your hassle that you have to do every day. And when the products get wasted, usually their female friends also come, and then they're saying, oh, he's not using anything, he's just getting wasted and all that. And there's another thing about men's skincare that I want to point out is their aftercare. When they do shaving and all, the aftercare is really, ignorant. They don't do much of aftercare, but when you look at medical research papers, it's really clearly seen that the most amount of damage done to a man's face is via doing the razor. When you razor your face, there's friction. So you're leaving on bare skin, frictioned skin, and when you're using those astringent, harsh acids, it's causing breakage of the skin barrier. So the aftershaves, yes. So I think it's a most important step for men to choose your aftercare.
And what is a good way? What do you think is the best? After you shave, what should you do to heal?
Products that has hyaluronic acid or glycerine. These are the products that will hydrate as well as improve the restitute your skin barrier. Okay. So those are better.
Because I've stopped using aftershave and I'm glad to know it's not good. Yes. But then I just wear my normal cream and then I get to going. I think I have to be more careful about shaving and aftercare.
What's your thoughts on anti-aging?
I think I'm at an age, 27 years old, where I have to prepare myself in advance, and if I take care of my skin from now, I can prolong my skin from wearing off with age. And I think that's the reason so many people do baby Botox, or the retinol is also recommended after 25. They say you can start using it just to prevent yourself from wrinkles. So I'm doing all of that from now. That's what my mother did from an early age only. She was taking good care of her skin and constantly taking care of her skin. And that's, I think, how, I mean, genetics play a huge role, which she's gotten good genes of skin. But at the same time, the only other way to improve your skin is skincare.
Yes. I'm sure everybody knows Parakram's mom. She's an epitome of beauty, and I really look up to her. I just want to greet her from here. So, hello, ma'am. So, coming back to your anti-aging tools, you're very right that a little bit goes a long way in your 20s. It's very important in your 20s to do religious regular skincare. That alone can really make a big difference when you're in your 40s, because if you compare two people who does good skincare in 20s versus the one who doesn't, you'll see the difference. You know, you've seen the difference in your aunts and our mums who did skincare versus the ones who did not. So you talked about baby Botox, so I just wanted to shed a little bit light on Botox as well. Botox, we're very happy that in Nepal in the last 4 to 5 years people are really welcoming. They're very warm about Botox now, but there's still patients who are very scared. They're very scared of Botox. People, the first question most of the people ask is what kind of side effects will happen in the long run, and will it hamper my health in any bad way in the long run. So for them, I just want to give brief information on Botox, is that in 2022, Botox celebrated 20 years of its cosmetic existence. In 2002, FDA approved Botox for cosmetic use, and in this year itself, there were celebrations all over the world about its existence. So something that's there for more than 20 years, that has been approved before 20 years, is definitely safe. And I say this every time to every patient, that Botox doesn't diffuse more than 1 centimeter of where you use it. For example, if I put it here, it doesn't diffuse into your lungs, it doesn't diffuse into your other organs. So it's very safe from that point of view. And secondly, there are so many indications of Botox now. Most of the people only know about the forehead or the upper face or just few areas. But now the use of Botox are really advanced into multiple areas, right? Like people come a lot for jawline slimming, for that chin, the puckered chin when people have...
They do it in the armpits also, no?
Yes, for sweating. Yes, sweating. And I think somebody had asked me about the nasal tip. Lifting the nasal tip. Yes. And then the flaring of the nose. If you remember, one of the very popular Indian actress had nasal flaring, but now she doesn't, because when she cried in movies, she used to have flaring of the nose. I don't want to take the name here. I'll tell you.
Oh.
Okay. She doesn't know.
Okay.
She doesn't have it now.
And she's made it public?
No, she hasn't made it public, but we can very well see it. I can tell the movie where she has flaring and the movies now which doesn't have those flares. So the nasal flaring, gummy smile, so many things can be corrected with Botox without looking unnatural. So that's the most important thing, that you will not look unnatural with Botox, and it's a very safe treatment. There are very few skincare that's come up. Like you said, skincare has become so popular in the last 3 years, while we do not have that long-term safety data. On the contrary, Botox has long-term safety data, and still people are apprehensive just because it's an injectable. If it came in a cream, imagine everybody would be wearing it.
And such a stigma where people are like, because people with wrinkles or people who are old get Botox, and I mean, some people in the West have gotten so much done to freeze their face. And then they say, okay, now it's frozen, which looks bad already. But they're like, oh, once the Botox goes, then your face jarros again. So it's like, oh my God, you're ruining your face. You're not seeing it as like something, I mean, like people who get Botox nowadays, you can't make out. You don't need to put so much for most people. It's like undetectable. So I think there's a lot of stigma attached. Everyone gets Botox. Every actor will get a little bit Botox here or there. It doesn't freeze their face.
I have done Botox like 6 years already. Yes.
So
we've both done, right?
And no one can make out. Is my face frozen? It's not. But I think, there's a lot of stigma attached, because I guess back in the days, some people have done intense Botox, and those have been sensationalized by the media that, oh, your face is fully Botox and frozen. People see that. People don't see the natural ones because you can't make out.
I think when things come out in media when you are very young, that leaves a big mark on your mind. I remember when I was younger, when I still wanted to pursue anti-aging and aesthetics, but I was not even a doctor, I vividly remember Cher, the singer Cher. She had Botox and she literally had those spokes brow, and it looked so weird. It was there in the front page of some media. So that stuck to my brain till now. So I can imagine somebody who's not a medical person looking at that and thinking like he will look like that. But then that's not the reality now. So we just want to confirm.
Like all these Kardashian Jenners, they're doing it in a nice way where they're looking pretty and looking good. You can make out they've done things, but it's not like how people did it back in the days.
Yes. Things have changed.
Yeah.
It's the Botox ko kura bhayo haina, ani Botox ko kura aunदाखेरि many times people also ask ki, is there any natural way of taking care of the skin and hair? And I think you have quite a good experience about natural skincare and using natural products for the hair. So what is your say on that?
So I think skincare, like my mom, she's been doing natural remedies all her life. But me, I've never been much into that. I've preferred using creams and things like that. And now with all these acids coming, I'm like, oh my God, this is more cooler. But for hair, I think natural, oils and ingredients are really good. I like this Kesh Kanti, Keshu hair oil where there are like 7-8 Ayurvedic ingredients in that oil. Apparently that is doing wonders. Everyone is speaking about that. I haven't used it, but I want to. But yeah, I think hair oils ko lagi I like using. And then sometimes the oils on your face that you have, rosemary,
Rose hip oil.
Rose hip oil, yeah. Those kind of things. I like experimenting with that.
And about the rosemary oil on hair, it's really catching trends, If you look at trends, there are so many videos made by doctors as well as influencers on rosemary oil and swearing by it. But then me being a doctor, I'd like to have a robust medical data first before I can really prescribe it to my patients. So that robust data till date, natural ingredients do not have those robust data yet. There's one paper that came recently on the title itself that the natural ingredients for the hair. So they talked about a lot of things. There are so many things like caffeine, peppermint oil, garlic even, and some amino acids, rosemary oil, castor oil, olive oil, avocado oil, almond oil. There's a series of data on that. But then none of them have multiple time and again proven papers. The best paper till date is of rosemary oil, which had 100 patients of androgenetic alopecia, and it was like a randomized control trial where they compare it with a medically significant lotion, which is minoxidil. So that paper showed that it worked as well as minoxidil without the itching, irritation and flaking of the minoxidil. That's why it's getting hyped a lot. But from here, from a medical perspective, I still wouldn't want to ask people to use it in their baldness as their number one or the primary single therapeutic modality. So this is about the hair loss. But when you talk about hair care and making your hair look fluffy, nice and gentle, the best data till date is of coconut oil. It has been shown that coconut oil actually enters into the hair. I have one video before this where I have given details on the structure of the hair and what makes it better, what makes it brittle. And when you go back to that data, you can compare your hair like to that of a bamboo. So when you peel off the bamboo, the inside is really soft. Same for our hairs. When you do a lot of keratin, when you do a lot of hair straightening, ironing, coloring, the outermost protective layering goes. So in those people, the coconut oil acts as a shield. It acts as a shield as well as it penetrates inside and it gives you that robust, nice hair. And now I think the relevance of oils are even more now because of the pollution, I was reading one paper on pollution which I found quite harsh, especially on the hair. There are data that pollution causes this, that on skin as well as for your health, it's bad, we all know. But it also adversely affects the hair directly by penetrating into the hair shaft. So that to an extent can be prevented by using the natural ingredients that you're talking about. The coconut oil, avocado oil, they can be used on the hair shaft and very minimally on the scalp. I do not recommend using on the scalp. Some people do.
But for people like us who have short hair, I don't like your hair is just come, it's literally come about, it's been what, 3 weeks our hair's come out from the scalp. Hair is healthy. For people like me, I feel like whatever oiling I do is not for my hair, it's for my scalp, just to keep my scalp health good. So what oil is good for that?
I'm still a bit apprehensive about using oils on scalp because it'll eventually end up clogging your pores. With so much of pollution, with so much of issues of scalp buildup, the scalp buildup, there's a term called scalp buildup, which means there's a lot of things on that hair. You have your oil, you have dirt, you have those smoke, you have the shampoo residues, hair mask, and on top of that, if you oil it, it's just going to be, that final, blow to the
So what's the
entire-
best way to moisturize your scalp? Because Kathmandu is so dry and my skin gets flaky, my scalp. So how do I moisturize it?
You can use serums.
Okay.
I think you have, one serum that I've given to you in the past. So that serum is quite good. It doesn't leave your scalp sticky, but also, moisturize it a bit. Besides that, the one that you said, you can use glycolic acid as a scalp scrub or a scalp exfoliator once in a month or once in 2 weeks. That also helps in, the unclogging the pores and then taking off the flake that's there. And otherwise, I would recommend to wash more properly.
Okay.
Give time for washing. It's not like before, you can just wash like in 2 minutes and go. Now you really have to, gently massage, and like you can feel it in your fingertips as well sometimes when it's very thick or cloggy. That you need to take your time and rinse it off properly. And nowadays there are lots of treatment creams of different brands. I usually do not like to name brands, but then just giving an example, there's something by Inkilist. Which is a scalp serum, which is a salicylic acid serum. I brought it myself from Bangkok. I didn't see a huge change, but it does, improve the flakiness. So you can use those serums, you can use the...
So serums are good to moisturize. It's not too, it doesn't block your pores.
Yes, but despite all your care, baldness cannot be prevented by these. This is the biggest misconception people have, कि baldness will be treated by, scalp care, hair care, which will not, because it's a disease.
It's a disease, it's a genetic thing. I think minoxidil is also good to thicken your hair. I always want thicker hair than I already have. Doctors say your hair is thick. All the doctors I've gone to have said your hair is thick, you don't need anything, but like I want it thicker. So I think minoxidil is good for that.
And I just wanted to give out a small information on hair care products that has come up recently, which is a bit alarming, especially for girls. So there was one paper that was published recently, which had data that was collected over 11 years on 34,000 women, and it was published by National Health Institute. It showed that women who do permanent straightening regularly have 4-fold increased risk of uterine cancer compared to women who do not. So which is really scary. And similarly, there's another one that quite shocked me. It's about the hair dyes, hair colors, the one that I've also done. So hair dyes also increase the risk of breast cancer in women by 2 folds. So when you use hair beautifying product, not hair care product, you have beautifying products and beautifying chemicals, you do need to think twice. And keratin as well. Keratin treatments, we all know that the Brazilian keratin treatment causes nasopharyngeal cancer, and it increases the risk of other cancers because of the presence of a chemical in it called formaldehyde. So that, I think I want to put it out because this is relatively new, this information is relatively new, and we, especially women, you need to sit on it before actually going ahead with these procedures very frequently.
Okay, so one of the other questions I wanted to ask is, you specialize in hair transplant, your social media is filled with there's so many concerns people have. One that I see in the future once I lose hair, when I want a hair transplant, is like, you'll take it out from here, the hair will get thinner from here, you'll put it here. But like, your hair is being lost because of the testosterone, which is going to keep getting lost. So like, how many times will you get hair transplants to keep getting it back? And where will you keep taking out your hair from? I mean, can you take it out from your body? Or I don't know how it works. Just like,
exactly.
Yeah, make it easier for us to understand. It's scary.
That's a very, I think, very smart question, because most people don't ask that. Most people come for hair transplant, they think you get it done once and you're done. So that's not how it is. As you said, baldness is a progressive phenomenon. It's an irreversible phenomenon. So wherever you lose hair from, you'll keep losing more. It's going to get worse in future. So the answer is not going ahead with hair transplant again and again. The answer is trying to preserve and keep whatever much hairs are left. So whenever patient comes to me, I always draw a chart, preserve and restore. So preservation is done by, as you said, minoxidil, and there are the many hosts of tablets, growth factors, PRP, LLLT. There's so many things now. So preservation is done by a host of things, and restoration is done by hair transplant. So as you correctly said, the donor is also going to get depleted, right? If you keep doing it again and again, you just have a around maximum 4,000 to 5,000 donor hairs maximum in someone who has good density, density at the back. So that will not fill 40,000, 50,000 hairs that you have at the front, right? So that mismatch will eventually happen if you keep doing hair transplant and not do anything else. So our major emphasis would be to continue medical therapy continuously along with hair transplant. And if at all needed, as you asked, if at all needed, we can take out hairs from our body areas. We frequently do it from the beard. As you said, we do post on social media about how we remove our beard and all. We frequently do it from the beard. Sometimes you can do from the hands, legs, and also from the pubes. But the problem problem with these areas is they do not have double, triple, 4 follicles unlike that of the scalp. The scalp has bunch of hair coming out from the same place, which we call follicular units. So when you take out one graft from the scalp, it can be 2, 3, or 4 hairs. But when you take out hairs from the beard and other areas in the body, it's just going to be 1. And moreover, hairs over here and other areas are finer, They're not the same caliber as that of the scalp hair. So you cannot expect the other body area hairs to fill in as much as the hairs that a scalp hair would. So the best, wisest way would be to go for hair transplant once, but continuing medical therapy for life. That's how it is.
Interesting. The bitter truth.
That's how it is.
Yeah, it is intense.
Yes. So, how was your day today with us?
Nice, good. I learned a few things about the oils and the hair care, and I hope you guys also learned.
Yes, I had a really good time today. I'm really saying very honestly. I had a really easy and nice talk with one of the nicest persons I know. I've said it in the beginning as well, and I'm saying it from the bottom of my heart. He's one of the most genuine people I've ever met. I'm really grateful that you gave time to our clinic, to us.
Thank you for having me.
Yes, thank you so much.